Earlier, we introduced you to Polly and her experience with urine leakage. Her issue was fixed with a sling procedure. We heard her say she wants all women to know this treatment is simple and easy. And one of the people she talked to about that was her good friend, Laura Culp. Here's her story.
I'm the kind of woman that if there's an issue, I like to talk about it with other people because somebody else might have been going through it and have an answer for me. So one day I was at lunch and I was complaining about the leakage, and Polly said, "Oh, you need to go see Dr. Jamie Long. She helped me." And I put it off and I said, "Oh, all right, whatever." And one day I was home and I had a gigantic sneeze, and it went right through my clothing, my protection, and right onto my love seat. And I thought, no, this is it. No, something needs to be done. This is just too much.
Laura Culp followed her friend Polly's advice and called Dr. Jamie Bayshore Long.
I encourage women to talk to their friends about these things because I think too often it's something that people feel ashamed of, and they feel like they have to hide because they're the only one who experiences this. But Polly fortunately was not shy about sharing with her friends that she had a great experience and it made a great impact for her. So she shared with her friends and told Laura about it, and Laura came then to us. Probably the area that impacted Laura the most was when she had a good hard laugh. And Laura is a lady who likes to have fun and likes to laugh and be with friends. So that laughing type of leakage was what was probably bothering Laura the most.
I got in almost right away, which was shocking because when you go to a new doctor, it's kind of hard. And everybody at the office is just awesome. So delightful, so pleasant, made you feel right at home. Dr. Long, she is amazing. I felt like I knew her for years. It was like having an old friend, just sitting and talking to her, and they made me feel so relaxed. She did a test on my bladder. She inserted water into my bladder and told me to cough, and then of course, what I coughed, it came out on her. She was so delightful about that. And she explained to me what my issue was, and she gave me 3 options.
The name of the diagnosis for that is called stress incontinence. So stress in that situation refers to a pressure, not an emotional stress, although it does cause emotional stress for people. But it's that physical force that pushes the urine out through the weak urethra. Urinary incontinence, meaning that you lose control over urine, is an extremely common condition. Over half of women experience it to a degree that it creates a bother or a, kind of an impact on their quality of life. So it's extremely common to have this affect a woman's life. And then when it comes down to kind of breaking down like what's causing that leakage, the stress urinary incontinence, part of kind of the global type of urinary incontinence, is a very common type of urinary incontinence. So about half of women who have leakage will have some component of that related to the urethral weakness and the stress incontinence.
The option I wanted for me was the surgery. There's 2 others, but those aren't as permanent. And I went for the option because of surgery, because I don't have any children. I thought later in life, if I need somebody to take care of me, let's get this done now. Let's get it out of the way. So I went for the surgery. It was awesome. Everybody at the hospital was amazing. And in and out, just like Polly said, in and out. I had no side effects. I had no pain. It was like awesome. And the next day, like Polly mentioned, I sneezed and I'm like holding my breath and nothing. It was just, wow, absolutely awesome.
The fact that they both had that component of stress incontinence and had the same procedure, I think that their outcomes are very similar and their experience was very similar. And they both become part of our office crew. My one nurse often calls it the dry panty club. That when patients come in at 6 weeks and she says, "Have you joined the dry panty club?" And so yes, those 2 have both joined the dry panty club.
Like Polly said, it's liberating. You're just like, oh, I don't have to worry about wearing something anymore. I don't have to worry about if I sneeze or if I cough or even if I laugh, something's gonna happen. And I encourage all women to call her. If they have this issue, call her. Get some answers, at least go visit, get your options. Don't wait. I mean, even if you decide not to do it, at least you'll know what the issue is if your bladder's healthy. It's just amazing. It just changes your whole life.
The options Laura is referring to include anything from exercises and gels up to that procedure. Like Polly, her recovery was quick and painless. She was in and out of the hospital in about half a day.